Thank you, Ceann Taoiseach. Last week I attended the launch of I Am Number 17 campaign, a determined initiative by 17 change makers who shared their stories, shedding light on the realities faced by patients with rare diseases in Ireland. They're committed to enhancing our understanding of rare diseases, demonstrating that such conditions are more common than many of us believe. Rare diseases include cystic fibrosis, Duchenne muscular dystrophy, Huntington's disease, alongside most cancers, especially those affecting children. Rare diseases are collectively common, affecting at least 1 in 17 people in Ireland, equating to at least 300,000 people. This figure very likely underestimates the true prevalence when considering rare disorders. In a nation as small as ours, it's almost certain that we have, know, or have encountered someone affected by a rare disease. Yet the path to an accurate diagnosis is fraught with challenges. The lack of specific knowledge and expertise often leads to significant delays in receiving proper treatment, placing a heavy burden on families and carers. Many rare diseases emerge early in life, with a staggering 30% of children affected passing away before their 5th birthday, though many cases are not identified until much later. The anguish of being ill without a diagnosis, or witnessing a child suffering without recognition, is profound. Thus, securing an accurate and swift diagnosis is critical. However, 37% of patients endure a gruelling 5-year quest for a diagnosis, often after being treated for unrelated conditions due to the complex nature of rare diseases. Irish research reveals that children with rare diseases occupy hospital beds 25 times more than other children, not to mention the significant care and cost burdens placed on adults with rare diseases. Taoiseach, the potential of genomics in addressing these challenges is immense, offering hope for quicker, more precise diagnoses. Yet our efforts to harness this potential through a national strategy for genetics and genomics medicine has been hampered by recruitment issues and the absence of a designated home for the new Central Genetics and Genomics Library. That laboratory is vital for the future of genetic testing in Ireland, yet plans for its relocation from the CHI in Crumlin remain unclear when the new Children's Hospital opens, with no alternative site being identified. This oversight jeopardises the effectiveness of our health service, leaving a crucial component of our national strategy in limbo and exacerbating existing inequalities. I implore you, Taoiseach, to personally address this critical issue. And let's ensure that the I Am Number 17 campaign leads to meaningful, lasting change, improving the lives of those affected by rare diseases in Ireland.
Thank you, Deputy. Taoiseach, please.
At the outset, I just want to thank Deputy Naughten for raising this important issue, and I know rare diseases is a cause that the Deputy has championed for many years now. I know the effect that rare diseases can have on many patients living with them, and at times it can be difficult to assess the appropriate medicines, technologies and diagnostic tools. We made commitments in the programme for government to ensure increased focus on rare diseases and people living with them, and we're now developing a new rare diseases strategy which will renew that focus. A rare disease policy unit has been established in the Department of Health. A National Rare Disease Steering Group was also established in December and has met 3 times since. The development of a new strategy will look to the future and the needs of those patients and families living with rare diseases and diagnosis. We expect to have the new plan ready well before the end of this year. And the voice of patients and families will be central to the development of this policy, and a patient forum has been established to ensure exactly that. In relation to the specific issue of the national laboratory capacity for genetic testing, we're fully committed to advancing genetic and genomic medicine in Ireland and building a national service. The central theme of the national strategy for accelerating genetic and genomic medicine in Ireland is to strengthen infrastructure and to drive advances in genetics and genomics. This includes actions in relation to laboratory capacity, In particular, the National Genetics and Genomics Office is working to enhance existing laboratory infrastructure to promote the development and the use of innovative technologies for testing, sample tracking and reporting. And a National Centre of Excellence in Genomic Testing and Bioinformatics will be established as a single entity, and that will sit under the governance of the HSE. The National Centre will work in collaboration with relevant clinical specialties and existing laboratory capacity in alignment with the new health regions. A genomics laboratory operating model is now being developed, and as part of this, for 2024, there is the development of a national genomic test directory and for rare and inherited diseases.
Thank you, Taoiseach. Deputy Naughten.
Taoiseach, last year the Minister for Health allocated 2.7 million to kickstart the national strategy for genomics and genetic medicine, aiming to bolster our health services capacity in genomics. However, progress has been stymied with recruitment shortfalls. At last count, only 10 of the 18 roles have been recruited under last year's allocation. The 8 outstanding roles are now not going to be appointed. They have been merged into 5 roles planned for recruitment in 2024. So by the end of 2024, there will be 15 new hires under the strategy rather than the planned 23 at that stage. And if the failure to recruit staff wasn't bad enough, as I say, there is no plan in place for where we're going to house the new main laboratory for genetic testing in Ireland when CHI Crumlin is relocated. Will they be left wandering the halls of an empty Crumlin hospital after everything else has moved out? Taoiseach, we need answers and we need action, and we need it now. Thank you.
Thank you, Deputy. Taoiseach.
That some of the posts that were approved in 2023 were affected by the temporary pause on new recruitment. A new workforce plan for 2024 is being developed by the HSE, and the HSE will be able to increase its total staffing levels by between 2,000 and 3,000 over the course of this year. This will include genetic counsellors and the development of the Genomic Resource Associate role to help patients navigate the genetic and genomic care pathway and improve the coordination of care. The 2.7 million provided to fund the implementation of the National Strategy for Genetics and Genomics included the establishment of the National Office of Genomics and the appointment of key staff. In relation to the location of the new lab, or whether it remains in Crumlin or not, I don't have a satisfactory answer for that to you today, Deputy, but I will discuss with the Minister for Health and come back to you as soon as I can.